Let's take another live look outside where once again we are under an air quality alert. It has been several days in a row of poor air quality from wildfire smoke hanging over the city and elevated ozone as well. Our 9 News health expert, Dr. Payal Kohli, is back this hour to talk more about this. So Colorado has 2 major air quality challenges.
You just said them, Phil. Yeah. You have the ozone, and then you also have the wildfire smoke. So let's talk about each of those. So ozone is essentially, it's called, as you've heard Chris say, ground level ozone. And that's the sunlight interacting with the pollutants in the air. So that's your city pollutants. Think about car pollution, industry pollution, factories, etc. That goes up in the summer during hot months across the Front Range. On top of that, we have these wildfires that create this particulate matter, these tiny little 2.5 microns, which is less than a third of a human hair, particles that are carried for thousands of miles that interact with the sunlight as well to worsen the ozone. So now think about 2 bad guys teaming up together. You have a 1-2 punch, and they're worse together than they are individually in terms of their health effects. So I really worry that this is a very concerning time, not just for our kids or older people, those with lung disease, but even for healthy people as we step outside.
And wildfire smoke in particular is so much more toxic than your typical air pollution. Why is that, though?
Yeah, so very interesting. It has 10 times as many toxins. And as I mentioned, they travel a lot farther. So we've seen West Coast wildfires go all the way to the East Coast. We've seen American wildfires go all the way to Europe. So I'm literally talking hundreds of thousands of miles. And then they have this particulate matter that dissolves deep into the lungs. So when you combine that with ozone, ozone creates the inflammation in the lungs that kind of opens up the airways, and then this particulate matter can get in, dissolve in our bloodstream, and cause effects like heart attacks, strokes, blood clots. They're even talking about inflammation of the brain occurring as a result of these particulate matters.
We often warn that young kids and the elderly need to be concerned, particularly. Why are children disproportionately affected?
Yeah, so I worry so much about the kids, especially, I don't know if your kids are in camp. Your kids are a little old for camp.
Older.
Right, but still they spend a lot of time outdoors, right? And so with these kind of air quality indices that we've been having, our kids are outdoors, you think about their lung sizes. So the dose of bad pollution that they're getting is higher. The dose to their body weight is higher. Kids have a higher respiratory rate than adults, so they're actually taking in more air when they spend time outside. And then their immune systems are immature, their airways are smaller, so the way that their body reacts to that is higher too. So there's actually data saying that more than 5 days of bad pollution to our kids can trigger long-term chronic changes in their lung development, because we know that their lungs develop well into like 16, 20 years old. And so if they're exposed to this bad air as children, it could affect how their lungs are as adults.
We know here in Colorado, unfortunately, we do have poor air quality that continues to go year after year. Does that have an effect on us long term as far as our longevity is concerned?
Believe it or not, it affects how long we live when we're exposed to bad air quality year after year. And that's why this year, especially as Governor Polis said, avoid those fireworks, avoid the barbecues too. Because even barbecuing and burning that charcoal, I know it sounds really difficult, but just with what we've had going on, I mean, we're talking about stroke, heart disease, lung disease, longevity could make us not just live, less long, it could actually cause more premature death and just cause death in general. Think about anyone who's pregnant, who's out there. That's not something you can change, right? We know that that can get to the baby as well. So I just think for all our fellow citizens, we all have to do our part to try to minimize pollution as much as we can.
Yeah. You're always trying to keep us safe, but I do feel like when you come in next time, you should just give me a list of things I can do rather than that I can do rather than that I shouldn't do.
It'll be a short
Well, so here's what you are going to do. You might go to a store and pick up a HEPA filter, right, and filter your air for the next few days, just because that air quality is so bad. So.
All right, Dr. Kohli, thanks very much for always keeping us safe.